Welcome. This is the Hard Things 2017 Annual Enrollment Webinar presentation. My name is Amy Marino. I'm the Benefits Specialist for Hard Things. In the next 30 minutes, we'll be going over the 2017 enrollment information, plan highlights, some plan details of the medical, dental, and vision plans. We'll go over how to enroll and then where to go if you have any questions. So this year, our annual enrollment is an active enrollment, and that means that all employees must go in and make your medical, dental, and vision elections, as well as your flexible spending account elections. Annual enrollment will run October 24th through November 11th, so it's a 3-week period to get all these elections made, and everything will be done on the HR zone and the benefits enrollment portal. And as I said, all elections must be made by end of day on November 11th. The system will close at midnight on the 12th. So you have until end of day. I highly suggest going in much earlier than that to make your elections, but you do have until then to make your elections, or if you choose to go back and make any changes. So this is a list of everything that you will need to elect for 2017 or decline. You can elect or decline. You have your tobacco surcharge verification, your working spouse verification, medical, dental, and vision elections, a goal amount for healthcare savings account if you choose to make that a part of your benefits plan for the year to pair with a high deductible plan, a healthcare or limited use flexible spending account, and then your dependent care flexible spending account. New elections must be made. So the big news for 2017, the thing we're most excited about, is that all contributions will remain the same. So what you're currently paying for coverage, if you choose those same plans for next year, you will continue to pay the same amount, and that's what comes out of your paycheck, as well as any costs associated with the plan. So your co-payments, deductibles, co-insurance, all of those remain the same for 2017. Hard Things will continue to offer the free medical plans we've offered for the past few years. It's an EPO plan, a PPO plan, and a high deductible plan, all through Blue Cross Blue Shield of Texas. There will not be any plan design changes, as I said, copays, deductibles, etc. We will continue to charge the tobacco use surcharge and the working spouse surcharge. And just to note, as a reminder, the working spouse surcharge only applies if you have a spouse who works for an employer that offers health care. However, they are choosing to be enrolled on the Hart Hanks plan. If they are a part-time employee that's not eligible for coverage, maybe they don't work, or they work for an employer that simply chooses not to offer health care, then they can be covered on the Hart Hanks plan, and you will not see an additional surcharge. Hart Hanks will continue to make contributions into a healthcare savings account for those employees enrolled in the high deductible plan. The healthcare savings account and the limited use spending accounts will no longer have the 2.5-month grace period for 2017. So that just means that when you're using the plans in 2017, all costs that you're reimbursed for must have been incurred in that plan year. You will not get to carry any of those funds into the first 2 months of 2018, as you've been able to do in the past. Hart Hanks will offer telemedicine in 2017. That's the big new addition for this year. We're very excited. We'll be using MD Live, which is a partner with Blue Cross Blue Shield of Texas. So because of this, you'll be getting new cards from Blue Cross Blue Shield that will have the MD Live information printed on there. So you do have to be enrolled in medical coverage to have access to this service. And you will get new cards. If something happens, especially with the holiday mailing, sometimes things get slowed down. If you don't have your ID cards for January 1, that's fine. You can continue to use your current cards because your member ID number is not changing. Your new cards are simply going to reflect the contact information for MD Live. So don't feel panicked if it's end of December, you haven't gotten your new card yet. Just hang on to the one you currently have. You can continue to use that till the new cards arrive. Then we'll talk about some details. So eligibility for the plan, and as before, you must be a full-time active employee who works 30 hours or more a week. Any elections you make during annual enrollment will begin on January 1, 2017. If you've waived coverage in the past, this is your opportunity to elect coverage. And after November 11th, you will not be able to make any changes to your plans for 2017 unless you experience a qualifying life event. That's the cutoff date, and changes cannot be made at all after that date. There will be no exceptions for late enrollees or for people who try to go back and make changes after the 11th. The system locks up and you physically cannot get in to make those changes. Some examples of qualifying life events, however, that may allow you to make changes to your plan mid-year are going to be the birth or adoption of a child, marriage or divorce, maybe your dependent loses eligibility, if maybe your spouse has a change in employment, maybe they start a new job that offers benefits you'd like to switch over to, or they lose their current job and lose their current benefits. In all those cases, you have 31 days to come and get enrolled on the Hard-Hanks plan. We're very consistent with that 31 days. If you come find us 32 days afterwards, it's too late. We cannot allow you to make the changes to your plan you'd like to make. So it's very important to keep that 31 day, that 31 days in your head going forward, especially if you know that you may be experiencing a life event in the year ahead. Eligibility for dependent. Eligible dependents include a legal spouse of any gender, children up to the age of 26, that's could be biological children, stepchildren, legally adopted children, one that you are guardian of. However, for legal guardianship, you must have documentation signed by a judge. Being notarized does not qualify for this plan. You must have a judge's signature. And then any unmarried dependent child of any age who is medically certified as disabled and dependent upon you can be covered past the age of 26 as long as you have doctor's information. We do verify dependents the very first time that you enroll them. So if you're adding a dependent for the first time for 2017, make sure you have a birth certificate for any children, as well as a marriage certificate for your spouse. And then a second piece of information for your spouse, something showing the marriage is still intact. The easiest thing to pull is your recent tax return. As long as it says married filing jointly and both names are on there, that's fine to use. Another good piece of documentation to bring is a mortgage statement. You can black out all the financial information, always black out socials. We just need both your names listed there. You will only have 1 week after annual enrollment ends to submit this paperwork. So if we do not have this documentation by the end of the week after annual enrollment, those dependents will be removed from your plan for 2017. Everyone must be verified. Please contact myself if you think this might be a problem, or the HR zone, and talk to us and see if we can work something out if you're having problems finding the pieces of documentation that you need. So let's go over the plan details for our medical plans. Now, we've offered these plans for several years now, but if this is the first time you're choosing to enroll in our medical plan, or maybe you're thinking about making a change, you'd like to see what options are out there, we'll go over the details of the plans quickly. Our Blue Cross Blue Shield of Texas EPO plan is our in-network plan, so you must remain in the Blue Cross network to have coverage, but this is our most popular plan. We have 90% of our employees on this plan. And one of the reasons of this is that even though it is in-network, we have a very, very robust network with Blue Cross Blue Shield. They have partnered with all the local Blue Cross networks so that no matter where you live in the United States, you have access to a very large group of doctors and hospitals. So you never have to worry about going out of network. 92% of doctors and 94% of hospitals fall into our Blue Cross Blue Shield network. So you should feel very comfortable electing this plan and knowing that most likely whoever you already see accepts Blue Cross Blue Shield, or there's someone comparable in network if you were to have to change. The co-insurance for this plan, the amount that you're responsible for any non-copayment services is 20%, of course, after you've met your deductible. That deductible is $750 for an individual and $2,250 for family. The out-of-pocket maximum is the most that you pay out of pocket each year before the plan picks up at 100%. It's kind of like where the faucet turns off for the year. For an individual, that's $6,000 and it's $12,000 for family. The copayment for a primary care physician is $45. Now, unlike an HMO, with our EPO plan, you do not have to have a primary care physician selected at the beginning of the year, and you do not need to go through a primary care physician to see a specialist. So, but they still have a copay for primary care copay for 4 different types of doctors. And those 4 are general practitioner, pediatrician, OBGYN, and internal medicine. So I kind of call it the PCP $45 umbrella, and those 4 doctors fall under that umbrella. Everyone else is considered a specialist, and there's a $60 copay. but your preventative care is covered at 100%. So make sure that you're getting out there and you're getting those yearly physicals. You're getting those well woman visits. You're getting your kids well checked. You're getting any age-based preventative testing. So that's any mammograms that are required, I believe, once you hit the age of 40, colonoscopies, things like that that are tied to an age. Once you hit those ages, make sure you're getting those preventative tests. Those are covered at 100%. An urgent care is a $50 copay, and then an emergency room is a $200 copay, and then you're still responsible for 20% of any cost on top of that. The $200 just gets you in the door, which is why it's so important that we want to point out the urgent care copay and remember about the telemedicine. These are all great options. We find a lot of ER visits are for things that could easily go to an urgent care and now can maybe be covered by telemedicine. Your kiddo has an ear infection on a Saturday night, call MD Live. They can help you with that. They can prescribe something for a $40 copay. We'll talk about them more in a second. But these are services that instead of paying that emergency room copay, you can start moving over to either urgent care or telemedicine and save yourself a large amount of money. So that's the EPO plan. Our next plan is the PPO plan. And the only difference between the EPO and the PPO plan is that with the PPO plan, you can go out of network. But we're starting to see a sharp decline in people enrolled in the PPO plan as they realize that their doctors are all in network. So you're paying more out of your paycheck and you're paying a higher deductible for the option to go out of network when 99% of the time you don't actually need to go out of network. But this plan is here for you. There are some people who have a relationship with a doctor that maybe doesn't take any insurance or doesn't take Blue Cross. And then there are some people that really just like knowing they can go see anyone they want. And in those situations, of course, this PPO plan is an option for you. If you remain in the network with the PPO plan, it very, very closely mirrors our EPO plan. The key differences I want to point out are the deductible, which increases to $1,500 for an individual and $4,500 for a family. Those are the only difference there. If you go out of network, though, is where you start to see a drop in coverage. So then you've got your coinsurance at 50% once you've met your deductible. That deductible is going to double to $3,000 for an individual and $9,000 for a family. And then your out-of-pocket maximum is $18,000 for an individual, and there's no max for family. You won't see any co-payments. Everything is coinsurance. You're responsible for 50% of the cost after you've met those deductibles. So if you've been in the PPO plan for a while, I always say this is a great time to check out the network. Is your doctor in network? Every year I have a couple converts. We sit down, we realize that they're only seeing in-network doctors. They can save themselves on their deductible, they can save themselves on what they pay out of their paychecks and move over to that EPO plan or in some cases the high deductible plan. So this is a good time to look at the options and kind of compare the plans and take a look at the network. If you have any questions on accessing the provider finder, which is at bluecrossblueshieldoftexas.com, please reach out to myself or the HR zone and we can help you with that. And then our third plan is our high deductible plan. And I still call this our new plan, even though we've had this plan, I think we may be going into our 4th year with the high deductible plan. But this is a very different plan from the other two. So I like to talk about it separately. This plan is exactly what it says it is. It's a high deductible plan. And that means until you reach your deductible of $3,500 for an individual or $6,850 for a family, you are responsible for the full cost of your medical expenses and your prescription expenses until you reach that deductible. Once you reach that deductible, you're responsible for 35% of the cost. And then once you reach the out-of-pocket maximum of $6,350 for individual and $12,700 for family, which at that point, of course, the plan picks up at 100%. However, we are starting to see more people migrate towards this plan, and there's kind of a couple different types of people that we see move to this. One of them is people that say, I never go to the doctor, never, ever, ever, but I know that for ACA purposes, I must have health insurance. This gives you basic coverage. Your preventative things or services are still covered at 100%. So as long as you're going in once a year, getting your well woman visit, getting your physical, getting any routine preventative blood work done, you're still not going to pay anything out of pocket. That's paid for at 100%. And then if something catastrophic happens, you do have some level of coverage. We're also seeing people move to this plan who maybe do use it a little bit, but they're also contributing to a healthcare savings account. They're being able to take advantage of any discounts that you get by being in the network. So say you have a case of bronchitis and you just need to get in and see the doctor. Without any insurance, maybe that visit costs you $300. Well, Blue Cross Blue Shield is negotiated with all their in-network providers. So maybe the in-network rate is $125. So you're already see some savings over having no insurance at all. That's what you're responsible for. And if you're putting money into a healthcare savings account and taking advantage of the money that Harte-Hanks puts in, then you're able to save funds up for when you do have more severe medical expenses, and you can use what's there for your smaller items during the year. This money, we'll talk about an HSA more in a minute, but it does roll over year after year, which is a big draw for people. And a lot of companies are moving towards high deductible plans. I really think this is kind of what group insurance is going to look like in the future. So even if you're not comfortable making the jump yet, you'd rather stay with something like our EPO plan, that's fine. But I definitely want you to see this plan and kind of start to get an understanding of how it works, because if it's not here, someplace else you may go, they may exclusively offer a high deductible plan, which is what we're starting to see more and more. Pharmacy benefits are all through Blue Cross Blue Shield of Texas. You can get a 30-day supply, and there's a $15 copayment for the generic version on both the EPO and the PPO plans. And then you go to co-insurance. You're responsible for 35% of the cost with a minimum $40, maximum $100, or 50% of the cost for that top level non-preferred brand names. Those tend to be drugs that you see a commercial for. Those tend to be in that non-preferred group. On the high deductible plan, you're responsible for 35% of the cost after you've met that high deductible, and then they're covered at 100% if you hit your out-of-pocket maximum. And then there's a 90-day option. Blue Cross Blue Shield has their own mail order company called Prime Therapeutics. You can get a 90-day supply and actually see some small savings. You're looking at a $35 copay for the generic version, still 35% of the cost with the brand name, and then 50% with the non-preferred brand name. And here's some more details on the high deductible plan and an HSA. An HSA allows you to put pre-tax money aside, and you can use that money to pay for the cost of your medical care and prescriptions until you reach your deductible. At that point, the plan picks up 65% of the cost, but you can still continue to use the money in your healthcare savings account that you're putting in pre-tax out of your paycheck until you hit your out-of-pocket maximum, and then the plan picks up at 100%. Some more notes on a healthcare savings account. It's a personal bank account. It's not a company-owned account. So what that means is that that money is going to stay with you, and it rolls over year after year. And if you leave Harte-Hanks, you take that money with you because it's a personal bank account. So you can continue to use the funds that you've put in your account if there's a period of time where maybe you're not working, or if you join a company that also offers a high deductible plan and an HSA, you can roll those dollars over much like a 401k account. Some other notes on a healthcare savings account: they are tax advantaged. So of course there are lots of rules around the plan. So to contribute to an HSA account, you must be enrolled in the high deductible health plan. You must not be covered by a spouse or domestic partner's health plan or healthcare savings account. You cannot be claimed as a dependent on someone else's tax return. You cannot be enrolled in Medicare or TRICARE for life insurance, and you cannot have received Veterans Administration benefits. So that's the HSA. A few more notes on telemedicine, which I believe we hit on earlier, but like I said, the company's MD Live. It's a $40 fee anytime you use the service, and they're available 24/7 via mobile app, online video, or telephone. There are some states that limit which services you can use, so just make sure you check the fine print. I believe Arkansas does not allow any telemedicine, and Texas limits it to, I think, telephone. You can't do video. So check your local state. You can also check, we have some flyers regarding MD Live that are posted on the HR Zone, and you can also go to their website, mdlive.com, and you can check out any other restrictions maybe for your state. This is a great convenience for common health issues, allergies, respiratory infections, ear infections. This will save you so much time in having to make a doctor's appointment, get to that doctor's appointment, maybe take time off work to get your kiddos to the doctor. If it's something simple enough, or those late night illnesses that pop up, especially ear infections and colds that get really bad, call MD Live, stay home, stay in your pajamas. They can help diagnose and prescribe medication for those issues. So this is a great new service that we're really excited to add for 2017. So these are the medical premiums that you'll see, and they are exactly the same as they have been this year. There are no changes in rates. You don't have to commit these to memory. They're built into the HR Zone benefits portal. So as you go along, you're going to see the cost of all the plans as you select them, and you'll get a running total along the side of the page with what you've elected for 2017 and what the associated costs are. Next, move on to our dental benefits. We're going to continue to offer Cigna HMO and the Delta Dental PPO plan. The Cigna HMO is a straight HMO plan. You have to be in network to have any coverage. It is a narrow network, so just keep that in mind. If you've never been on the HMO before, please make sure you check out Cigna.com. Better yet, call your doctor, call Cigna, and ensure that they take Cigna DHMO. It is a very limited network. If you were in the Texarkana area, or if you were in northern Massachusetts, southern New Hampshire, and upstate New York, those seem to be places where the network pretty much falls out. So your best bet is to just go with the Delta Dental PPO. You know that you'll have a much larger network of dentists to choose from. But if you are in an area with a larger network for the HMO, you're looking at no deductibles, no calendar year maximums. Your preventative services are covered at 100%, and everything else runs on a co-payment schedule. You can find that full co-payment schedule on the benefits communications page of the HR Zone. Orthodontics are also covered on the HMO plan for both dependent children and adults. The PPO plan, Delta Dental, we've had this plan for, gosh, at least 10 years now. It allows you to go in or out of network. You've got a $50 deductible if it's an individual, $150 if you're family covered. There is a calendar year maximum, or the most that the plan will pay for each person enrolled per year, and that's $1,000. But your preventative services are covered at 100%. Basic services, things like fillings, are covered at 80%. And then major services, things like root canals, are covered at 50% once you've met those deductibles. Orthodontia services are limited to dependent children only, and there's a $1,000 lifetime maximum for that. The Delta Dental network is much larger. It's a very robust network. You probably already see someone that accepts Delta. They're one of the largest dental insurance companies out there. But still, it's a good idea to check their network, deltadental.org. You can go in or out of network, but there are some conveniences to staying in the network. One of them being they've negotiated lower rates. So if, say, you're paying 20% of the cost of a filling, you're paying 20% of an already negotiated lower rate. And also they take care of all the claims filing for you. And I don't know about you, but I hate completing claims forms. There's usually a lot of details. It's hard to get completed. You have to wait for them to approve it. If you're in the network, the dentist is going to take care of all the paperwork for you. But if you go out of network, you'll probably have to pay out of pocket up front and then submit for reimbursement. These are our dental rates. They're the same as they have been this year, and they've been the same for several years now. This is your per paycheck amount. We take deductions twice a month. So this is what you can expect to come out of each check, and these are also built into the benefits portal for your convenience. Our vision benefits also staying the same for next year. Will remain with iMed. You can go out of network, but when you do go out of network, it becomes less insurance and more discount. So it's a good idea to stay in network, and they have a really nice, robust network. It's a really good mix of private practices, places like iMasters or optometrists you might find in a Target, as well as glasses.com and contacts.com also fall within their network. So you're covered once a year for an eye exam. There's a $10 copay for that. If you're getting a pair of new lenses for your glasses, there's a $15 copay for the materials. And then every other year, you're allowed to get new frames, and you have a $120 frame allowance. If you're getting contacts in lieu of glasses and lenses and frames, there's a $105 allowance towards your contacts, and then you're responsible for everything on top of that. And then these are your semi-monthly contributions. Once again, these are remaining the same as they have been last year and the previous year. So those rates have remained very steady, and these are also built into the HR Zone enrollment portal. Remember, you do have to make flexible spending account elections. That's per the IRS every year. We briefly touched on the biggest change for the flexible spending accounts for 2017 is that you're losing that 2.5-month grace period. It doesn't apply to this year, so if you get into January and you still have some funds left in your flexible spending account, you can continue to use those until March of 2017. But for next year, anything that you have, you can only reimburse for claims incurred in 2017. It won't roll into 2018. So just keep that in mind. The biggest difference that you'll see up front is that you just need to think through your contribution a little bit more for next year, knowing that you won't be able to carry those over into the next year. But you can still set aside up to $2,550 in pre-tax dollars to use for qualified healthcare expenses. This includes your dental and your vision expenses, as well as prescription drugs. These come out of your paycheck. We take deductions twice a month. There is a really nice debit card option that goes with your medical flexible spending account. You can use this at your doctor's office, at the dentist, picking up a pair of glasses, at the pharmacy. These cards are good for 3 years. So if you have a card right now, check the expiration date. If it's not December of 2016, hold on to it. You'll keep using it for another year. Anyone with a card coming up that is expiring, you'll get a new one sometime in December. We do have a limited use FSA that is designed to complement a healthcare savings account. So you must be enrolled in the high deductible plan to enroll. And really, I'll be very honest, this plan is best if you have maxed out your HSA contributions. This limited use FSA, it works like a healthcare flexible spending account, except it's limited to dental and vision, but it doesn't roll over. So if instead of putting $200 in a limited use FSA, put it in a healthcare savings account, and you'll get money from Hart Hanks, and the money will roll over for 2018. So I get nervous when I see people only contributing to a limited use FSA. That's really not a good idea. Your best bet, put everything into a healthcare savings account. When you get to the maximum that you're allowed to contribute for 2017, if you'd still like to put pre-tax money aside, then look at a limited use FSA. But if you're not going to be doing that, then this is really not the best option. It's simply there for those who wish to contribute on top of their full HSA contribution amount. And then we have the dependent care flexible spending account, and this is to pay for daycare and elder care. This is not paying for your dependent's medical insurance. It's to pay for any after-school care, daycare. Maybe you have an adult dependent that's dependent on you, and you need to put them in adult daycare during the day. These funds can pay for those expenses. You can set aside up to $5,000 per family each year, and it has the same rules as a traditional medical FSA. It doesn't roll over. Some differences are going to be you do not have a debit card option, and you can only be reimbursed for what you've put into the account. As a note, if you are someone who contributes to the dependent care flexible spending account, make sure you're talking to your spouse. It's per family, and every year I get a couple people that come to me and say, oh, we both put $5,000 in our dependent care account. At that point, it's none of Hart Hanks' business. We can't do anything for you. That's between you and the IRS. So have that conversation in the next 3 weeks. Your spouse is probably either going through annual enrollment or about to go through annual enrollment, and decide now who's going to be setting aside the dependent care money for next year. Our life and disability benefits remain the same, and they're rolling over, which is a nice convenience. So your basic life and AD&D, Hart Hanks pays 100% of 1 times your annual salary to a maximum of $100,000. $2,000 for a spouse, and $1,000 for dependent children. If you're already enrolled in this, it's going to roll forward, nothing to be done. For the voluntary life and AD&D, employees may purchase up to 5 times your annual salary for yourself, or up to 50% of your elected amount, or $150,000 for your spouse, whichever comes first. And then we have a flat $10,000 policy for dependent children. If you have been offered this before, so you're not a new hire, you will need to complete a statement of health form before we can set you up for any voluntary coverage. There'll be a form for you to fill out. It's called the Evidence of Insurability form, or the health summary form. This must go back to Cigna directly. It's your responsibility to get it to Cigna, and we'll have to wait for them to approve your coverage before we can set it up. This normally takes about 8 to 10 weeks during the annual enrollment period. Salary continuation is a Hart-Hanks policy. It's not a one that you enroll in. It protects a portion of your income if you're disabled for a short period of time, and it replaces up to 60% of your salary. So this is all found on the HR zone. This is not something you'll find in the benefits enrollment area, because as I said, you don't enroll in this. This is simply an internal Hart-Hanks policy. But it's just a good time to remind you that that policy is there. And then we have long-term disability. Once again, you're not going to need to enroll in this. You become eligible after 1 year of employment. Hart-Hanks pays 100% of the cost, and it replaces up to 50% of your salary. You do have to be out 6 months before this plan may begin to pay out. It is offset with other sources of income and pays to the age of 65. You won't even see this when you're going through enrollment, but you'll see it on your final summary. And like I said, it's simply because this is something that Hart-Hanks offers to you. And then retirement benefits. Now, 401k does not go through any sort of annual enrollment period. You can, after you've hit your 3 months of employment, you can begin your contributions and you can stop them, up them, lower them as you wish during the plan year or during the year. But this is just a really good time to remind people that this benefit exists. And employees may contribute up to 15% of your earnings, and Hart-Hanks will match contributions dollar for dollar for the first 3% and 50 cents on the dollar for the next 2%. You're immediately vested, and you enroll directly with Merrill Lynch. There is nothing on any of the Hart-Hanks sites that will allow you to enroll there. You must go to Merrill Lynch directly. And really, that's the best place to go for any questions with your 401k. I am not a tax specialist. No one here is in HR is a tax specialist. Merrill Lynch, this is their specialty, and they're really good at it. So go to their website. They've got some great tutorials and different tools to help you if you've never enrolled in 401k before, or give them a call. They have a really great customer service line. They can help you get enrolled. They can help explain the different plans for you. They're the experts. That's why they administer this for us, and they can help you with all of that. And just make sure you designate a beneficiary for your 401k account with Merrill Lynch. You'll be asked to select a beneficiary for your life insurance coverages on the HR zone, but those will not also roll over for 401k. You must designate your beneficiary separately. As we've talked about, you're going to enroll through the HR zone. If you were here last year, this is how it was done. And any new hires, if you were new hires sometime this year, you went through the HR zone. It's hr.harthanks.com. From that page, you'll go down to My Benefits. The first page you come to is our communications portal. And so many people have been just skipping this page, but this is a really useful page to use all during the year. If you go up to benefits documents, you'll see open enrollment information. There you'll find all of our plan details. You'll find our benefits guide, which you can also find on the main page. I have put it right in your face so you can't miss it. This is kind of our plans, almost like it's Bible for the year. This is where you find all the information that you'll need regarding co-payments, deductibles, and the cost to you for all of these plans. So go in, pull the guide, and keep it on hand for you all during the year. But don't just move on. Stop and look around here, see what all the information is out there, because a lot of it's very useful. Once you've made your decisions, you'll click Enroll Now, and you'll move on into the enrollment portal where you'll make your elections. One other thing that's on this communications page is a navigation guide to help you get through the enrollment portal. It's very intuitive. Most of you will get in there, you'll click Get Started, and you'll go right through it, and you won't have any problems. But just in case you get caught up on a couple of the little quirks it has, we have a detailed navigational guide that can help. It's full of screenshots to help you understand what you're seeing and know how to move forward through the site so that you get through the first time and get everything set up. If you have any questions after this, you can always contact the HR zone Monday through Friday from 8 to 5 Central. Their number's listed there. Or you can always contact me. My email address is listed there. During annual enrollment, it gets very busy. I am the one benefit specialist for all 3,000 US-based employees. So it does get a little tight. So email is the best way to reach me. I will be traveling for a week, so I won't have access to my voicemail. That's why I always direct people to the HR zone first. There's much more of them, many more of them than there are of me. But you can always reach out to me if you have any questions as well. Thank you very much. And please contact myself or the HR zone if you have any questions. And remember, this all needs to be done by the end of day on November 11th.